Thanks, Minister. So just an update on our most recent Omicron cases, and you would have seen a media release this morning. So we've got an additional 4 cases of Omicron variant detected in the community. That takes our total of cases to 10. So a public health update went out early this morning to advise people who have attended the Circuit Bar in Fitzroy and the Peel Hotel in Collingwood to quarantine and get tested if they were at those venues on the 10th of December. There were more than 450 people at the Circuit Bar and there were more than 400 at the Peel. And so the quarantine period for those individuals begins from the last time of their exposure for a 7 days. So if they were there until early hours of Saturday morning past, they'll need to be in quarantine until Saturday coming. Of course, they're all required to be fully vaccinated and check in via the QR code. So we don't expect that there are unvaccinated individuals there, but we've provided advice on the 14-day requirement for unvaccinated individuals nonetheless. And we do thank everyone for their assistance. Really, thanks to that QR check-in, we've been able to contact almost all of those 850 plus patrons who've checked in, and they've been directly messaged, and there'll be further contact through the course of today. In relation to booster vaccines, and as the Minister has said, we're really wanting to emphasise just how important the boosters are. We've got over 720,000 individuals who are now due or eligible for their booster. Some 442,000 are now overdue, in large part because ATAGI has shortened that interval to the booster from 6 months to 5 months. So there are a few 100,000 additional individuals who've immediately become eligible. We've had 175,000 who've already come forward to get their 3rd dose. And we are seeing an increase, about 25% in our walk-in traffic for that booster dose, and I expect there'll be tens of thousands of people in coming weeks who'll come forward for their booster dose. That demand is there, and now that people are eligible, I think we'll see a very significant increase. But a lot of people are eligible. I'd love to see each and every one of them get that booster dose for that additional protection. There are 10 pop-up vaccination clinics this week. They're across Casey, Whittlesea, Darebin, Melton, Maribyrnong, Melbourne CBD, and includes 4 on the weekend. The clinics will be at train stations in Footscray on December 16-17, so that's tomorrow and Friday, Epping Plaza on Saturday, December the 18th, and Homeless Support Services. They'll be offering boosters, but also 1st and 2nd doses for those who still need them. And I do think the numbers will catch up very quickly. So everyone who's 5 months from their 2nd dose are really urged to book an appointment to get that as soon as possible. I'll be due in late December. I'm already booked in, looking forward to that booster dose. We're especially wanting to flag it with those who are at greater risk of exposure, but also are working with more at-risk individuals, so those healthcare workers, those in aged care and disability support services. In addition, if you're wanting a Moderna booster, these will be available across our state-run hubs, administering the Moderna booster from Monday. It really is your best chance of avoiding serious illness. We know that with Omicron, there has been some vaccine breakthrough. There's been some breakthrough for those who have natural immunity from past infection, but there's good evidence, and it's getting stronger by the day, laboratory evidence and now epidemiological evidence, that getting or having had your booster shot will protect you even more from serious illness. That direct protection for those people who are vaccinated is critically important, and we know that the most at-risk individuals are older individuals, so I want to especially point that out for anyone who's due. For our hospital system, there are 365 currently in hospital, 85 active cases in intensive care, 46 of those on a ventilator, and an additional 44 cleared cases in ICU. For those in hospital yesterday, 73% were not fully vaccinated, and 58% didn't even have their first dose. For those in intensive care, 91% were not fully vaccinated, 88% hadn't had their first dose, so no vaccine at all. We're talking about the eligible population in ICU, so if vaccines did nothing, you would expect 92, 93% of people to be fully vaccinated, but we're seeing a tiny proportion who are fully vaccinated. Everyone else is not fully vaccinated or has just one dose. So if that's not a story of the protection of vaccines, I do not know what is. So please consider. I know, there are 330,000 people currently eligible, not yet having received their first dose. Our behavioural surveys tell us that maybe 150,000 of those are determined not to get a vaccine. They won't listen to me. They probably won't listen to their own family or anyone else. So be it. There's probably another 150 plus thousand who, for whatever reason, have not gotten around to it, are ambivalent. Again, if you don't want to listen to me, don't listen to me, but please talk to someone you trust, a trusted nurse, a trusted GP, a trusted pharmacist, a trusted family member who's received their vaccines, so that you can consider exactly what this means to keep you out of ICU. 3 people have lost their lives in the last 24 hours in their 70s to 90s, and my thoughts go to their families and friends. Testing remains good. Over 77,000 tests processed yesterday. There's still plenty of capacity over the Christmas period. The state sites will continue to operate through that period. And overall, we had 1,405 new cases yesterday. 5 were overseas acquired. And as you may have seen, 1,360 cases in New South Wales announced today. So that's Omicron driven. I think we'll see a significant increase in our Omicron cases. The story globally is that it's doubling every 2 to 3 days. It's gone from a few hundred cases in South Africa to tens of thousands in a matter of a few weeks. Wherever it's seeded into Europe, it's gone from small numbers to hundreds and thousands of cases in a relatively short period of time. It's replacing the Delta variant. I think that's going to happen globally, but we'll continue to watch that. There's clearly some vaccine evasion, so people who are either naturally immune or have been vaccinated can get the Omicron variant, but it still provides that really important direct protection from serious illness. And for a variant that might get to tens of thousands of cases in many countries around the world, that is critically important for everyone who's eligible and able to get vaccinated. It means that we must consider our boosters. We don't know the full protection that boosters might provide, but it's going to be more than 2 doses. Again, the laboratory evidence of immune protection is very good, that boosters will provide some additional protection from Omicron as for other variants. It does mean that we should all be keen to see our kids vaccinated, again, for that direct protection. They're less likely to get severe illness, but it does increase their chances of staying in school through term 1. It increases their chances of protecting their close family members, including those who are most at risk. And all of those other measures beyond vaccination, masks are critically important. So we've got mandates. They remain in retail. It's strongly recommended in any other indoor setting. Ventilation, hugely important, whether it's home, your workplace or other settings.